So I'll start presenting the project I made, this COVID-19 risk mitigation. This was a work done in an internship during this summer at INREA, supervised by Isabelle Guillon. So I'll start by presenting first the problem setting for my project. I'll review some of the existing approaches on modeling and simulation and policy design in general. Then I'll detail my approach, show you some results and some discussion about them, and I'll finish by the current work I'm doing on the continuation of this project in an X-Prize pandemic response challenge organized in the United States. So the problem setting, as you may infer, is the ongoing COVID-19 pandemic that as of today has had more than 100 million contaminated people and more than 2 million deaths across the world. And on where initially the main strategy was on how to reduce contacts, especially when we didn't have any specific treatment or vaccine to treat this disease. The drawback of this strategy is that the stringent policies, firstly, they erode economic health because they change the normal setting compared to a pre-pandemic state, for example. And the policy design game, in a sense, hasn't had a single recipe. We have seen that every country has acted more or less differently with different priorities and strategies, enforcing lockdowns or not, closing business or not, enforcing usage of masks, etc. And of course, it's a very difficult problem for the policymakers or the governments in general because we have lots of hidden variables. And we can more or less rely only on local data and summarize, such as the number of total infections or the number of total deaths. So what do we understand by policy design is that when a controlling agent, in our case, we'll understand it as government, enforces the usage of non-pharmaceutical interventions mainly, such as, for example, modifying the individual transmission rate by enforcing the usage of masks or hand sanitizers. On the more global scale, reducing the transport across different regions, closing certain businesses, etc. We can also have like economic measures such as giving checks, for example, in the case of the United States. And all of these measures are summarized by this stringency index that has been developed, for example, in the Oxford University. And they summarize all the measures taken by the countries from a number from 0 to 100, where 100 is the maximum stringency and the country is basically stopped during that time. So this stringency comes, of course, with a trade-off in the economy. We have observed that in 9 months after the beginning of the pandemic, this COVID-19 recession has been the steepest in the last 40 years. And this recession has affected the whole world. We have, for example, at the right, emerging economies in gray and advanced economies in black, and they have more or less the same variation in production especially during the months of April to June of the last year. So that's for quality design. In terms of modeling, we have mainly two approaches. The one is the simulation models. Most of them are based on the differential equation epidemiological models, such as the SAR model, for example, and the different variants of that. We can also have agent-based modeling to have more individual interactions, more detailed behaviors, for example, at a person level. And we can also find some classical statistical curve fitting and deep learning models more recently. In terms of scenario simulation, the decision-making process is understood mainly as the economical approach, where the planifying agent is trying to set, for example, a fiscal policy or an interest rate by the central bank, etc. Some of those studies have included, for example, the number of new cases in order to do that. But the thing is that in order to do a policy design not only the economical side, but concretely on the stringency, there haven't been much effort. So one of the motivations for this project is precisely that there are very few studies that cover policy design in the sense of stringency. And also with the framework that I present to you, it's one objective is to give insights to policymakers, mix, of course, these epidemiological and economical approaches, and once the framework is set in, discover new non-classical approaches, because once we can grab some algorithm and play with this running world, we can discover new non-classical approaches not taken currently by any country. So the problem itself is understood as a market decision process where the environment is the simulation model in particular. In our case, we use an SEIRD model when we distinguish recovered and deaths compartments. The agent in our case is the government that, it doesn't belong itself to the environment because it doesn't have a population, but it can act in the form of the stringency that I previously described in order to modify how the different rates in the compartmental model are behaving. So in the world itself, this is the epidemiological simulation. I consider only a first outbreak during less than 6 months, where there's no new births, so we have a constant population size. And this allows to set this problem as an episodic game. We can only observe, as the data is publicly available only on the infected and death by COVID-19, and we limit the study in one model per country, because during this pandemic we have seen that most of the countries have remained isolated from the rest. And we feed the model on real data, and then we can play a theoretical game in these countries. Another important aspect is that the population is not segmented by region or geographical segmentation, but by economic sectors. Why? Because during this pandemic also we have observed that people didn't change jobs that much. Either they went to work or not, but they didn't. There wasn't a massive changes on the production sectors of a country. So the model itself is, as I said before, is an SIRD model where each I or each sub-model is on an economic sector and not on a region. So what's this model? We have basically 5 compartments. The S is the susceptible population, exposed population, infected ones, recovered, and death. Each of these compartments are mutually exclusive. This is one person can only be in one of these 5 compartments, and these rates that you see in the arrows govern the passage from one compartment to another. For example, for in beta is the transmission rate, sigma is the incubation period of the disease, gamma is the recovery rate, and mu is the morbidity rate. So the hypothesis of this model, again, we only consider one disease, one infectious disease. There's no reinfections. We consider no new births. So the sum over these 5 compartments stays the same. The population partition indexed by the letter I is again by the economic sectors and not by a specific region. And all of these economic sectors are independent. So, for example, the infected population of one economic sector won't affect the susceptible population of another one. And of course, there's no latent variables. We consider that data as it is because estimating the real number of, for example, testing infected and deaths is another problem that we don't tackle in this project. The reward itself, and I say reward because we cannot really talk of our reward when we're talking about deaths or infected people, is the one that is considered by the planning agent, this in our case the government, and the government basically is trying to reduce the number of deaths using a minimum stringency. So we can define, for example, an instantaneous reward every day, penalizing the number of deaths, and another proxy of secondary deaths, for example, by the letter F. and also the sum of the stringency that are maintained at that specific day. This reward allows to pose this planifying problem in 4 different ways. We can think, for example, of reducing the stringency across an episode such that the deaths are bounded, or we can minimize the deaths such that the stringency is bounded, and we can say the same thing, but this time thinking about the peak of the deaths, or the peak of the deaths bounded, or minimizing the peak such that the stringency is bounded. The more realistic approaches are the second and the fourth one, because S is the factor that we can more easily control and more easily bound. And basically, we're trying, the ultimate goal is to minimize deaths. And the only action that you can make is modifying S. So in terms of experiments, I work with available data, publicly available data, such as the number of disease-infected populations across the world, as well as the stringency index that I mentioned earlier. In the case of France, we also have the information of daily deaths during the first month of 2020 by all causes, not only COVID. And also we can find the fiscal spending in order to try to quantify the trade-off between a cost of augmenting the stringency versus a cost of having more deaths. So the fit of the model, I mean, it's still a epidemiological model, so the fit works already. But the interesting part comes when we try to understand the dependence of the transmission rate and morbidity rate with respect to the stringency, that is the action. Again, the action is not an input to the model. The fitting model only sees deaths and infections. But here, if we plot, for example, the transmission rate across 160 days in blue, in yellow, versus the stringency measures that we're taking in France in this case over the same period, we can already see that the transmission rates, it's roughly at the same time when the most stringent measures were taken into account. Well, we observe this same behavior in other countries. For example, here we have Italy, Germany, and China. And of course, in the final report, you will have more results of this kind. But let's study the influence or the relationship between the stringency and the transmission rate in our case. So before, we saw that the transmission rate was reduced once we got to a certain stringency, and we maintained that stringency for a period of days. Here, in the x-axis, we plot the day where the stringency index was superior to 50, and on the y-axis, the day where the transmission rate was reduced. And we already see a linear relationship between these two, which already, of course, makes sense, because the earlier we act, the earlier we'll reduce the transmission rate. If we try to expand this to all the countries that the model was successfully fit on, we can distinguish 4 regions again. The first one is to act late. This is enforce measures late in time, but get an early reduction, which in reality is impossible, because we cannot get a reduction in the transmission rate if we didn't do anything in the first place. And the model at least captures that, so it stays realistic in that sense. Then we have the act late policy and get a late reduction in transmission when we have the mostly developed countries. A very interesting segment is the countries that acted early with respect to the outbreak, but got an late reduction, in the transmission rate. And we see here that there are mostly emergent economies or very poor countries, actually. So there's a dependence on the country features themselves on how the stringency affects the transmission rate. And lastly, we have more or less the majority of the countries that acted early with respect to their outbreaks and got early reductions. Of course, this has to be studied carefully. For example, in the case of Brazil, we have seen that in reality the measures are not that stringent. But again, we are working with the data as it is, And yes, so this needs to be taken into account when studying the results. If we try to map this relationship between the reduction of the transmission rate to other variables, such as, for example, the days during when the stringency measures were maintained, the relationship is much less clear. And it's the same case when, for example, we try to compare two country features, such as the share of population living in extreme poverty, or, for example, the cardiovascular disease incidence. So the main takeout, one of the main takeouts is how S affects these different sectors, transmission and morbidity. This parameterization is in some cases evident, such as, for example, the day when the stringency was attained certain threshold and the day when the transmission rate was reduced. But for other features, it's less clear. So one idea is to to train another model to learn this relationship and maintain this simulation model as the world in a sense. The control features has to be included also in this analysis, because we saw that poor countries, even though they acted early, they got a late reduction in the transmission rates. So all in all, it sets for an interesting framework to study the effects of the stringency on the deaths and infections of COVID. So the main takeout is the policy planning problem is seen as an MDP, where the world runs on specific disease parameters, such as, for example, the incubation period and the recovery date in the case of the model I presented. The impact of rates depends, of course, on the measures, and this mapping needs to be learned from data. And once we have this mapping with S and the transmission rates and the simulation model, we can just perform counterfactual analysis to discover new policies. And maybe also the algorithm could find like the exact same policies that were applied in reality. So I just take 30 more seconds to talk about what I'm doing now. The continuation of this project is the pandemic response challenge, where we basically have to do this same task of setting or prescripting new policies. So currently I'm the leader of one of the finalist teams, alongside and we're working with other students in Paris-Saclay and Polytechnique, and we have been advised by researchers in Paris-Saclay, United States, and Barcelona. So in 3 days we have our last submission. So we'll see how that turns out. Yes, so if you want more info, you can visit the repository of the internship, the repository of the current challenge, or the webpage on the challenge. That's it. If you have any questions.
You use use data released by the countries to fit your model. So my question would be, if you try to complexify your models, like you said, is one of the possible future direction. So if you try to complexify the model and add more possible interaction and maybe country-specific model interaction, do you think that you would need more data? My question would be, at which point, until which point do you think you can complexify your model until you need more data than is available?
I think for finding this relationship, for example, between the stringency and the reduction on the transmission rate, I mean, it cannot be a super complex model, because soon we have too many parameters for the data we have, considering that this is only we have only 1 year of data since the first outbreak. Maybe we could use some previous pandemic, such as the SARS in the 2007 or previous ones, but I mean, it has to be fairly simple in a sense, this parameterization. Otherwise, we wouldn't learn anything. I mean, we wouldn't have enough data to feed them.
Okay. Well, thank you very much for your answer, and thank you again for the presentation.